Welcome to Didn't Get Frazzled presents the Shingles Shot for Patients. We will discuss shingles, the symptoms, complications, and treatment, and shingles prevention, which is the shingle shot. Shingles is caused by a reactivation of varicella zoster, the virus that causes chickenpox. It is a herpes virus, but not the virus that causes genital herpes. Once you've had chickenpox, the virus stays in your nerve roots and will remain latent or inactive. The virus can reactivate to cause shingles due to emotional stress, like being anxious, working long hours, not getting enough sleep, physical stress, like recent infection, injury, or surgery, or from medications that inhibit the immune system, such as chemotherapy or steroids. Shingles manifests as a painful rash on one side of your body. Many people develop pain, itching, or tingling in the skin before the rash develops. You may also develop flu-like symptoms. The rash will follow the distribution of a nerve, so it appears as a band around the trunk, arm, leg, or the face. After 7 to 10 days, the rash may crust or scab over. Generally, the rash clears up in 2 to 4 weeks. While shingles is most common in people over age 50, anyone can develop shingles, even children. The lifetime risk of shingles is 10 to 30% and increases with age, affecting up to half of people who live to age 85. The most common complication is post-herpetic neuralgia. This is when the pain persists even after the rash clears. It affects around 1/3 of patients over age 60 who develop shingles. If the rash appears on the face, near the eye, or on the tip of your nose, you may develop a severe infection of the retina, which can lead to vision loss. Urgent evaluation by an ophthalmologist is required in this situation. Shingles is a viral infection, so antibiotics will not help. However, if you scratch the rash, you can introduce bacteria and cause a secondary bacterial infection. Encephalitis is a rare but serious complication. Symptoms include headache and confusion. Unlike chickenpox, which is highly contagious and can spread by droplet or direct contact, shingles cannot be transmitted to cause shingles in another person. However, an individual who has never had the chickenpox infection or vaccine may develop chickenpox after physical contact with the shingles rash. There are approximately 1 million annual cases of shingles in the U.S., resulting in just under 100 deaths per year. Mortality is highest among the elderly and immunosuppressed. There is no cure for shingles, but antiviral medication can decrease the length and severity of the infection. The medication works best if started within 72 hours of the rash. Other treatment is supportive. If you develop any of the complications we discussed earlier, these also need to be treated. Unfortunately, the only prevention available is the shingle shot. Zostavax came out in 2006 and is the only approved shingle vaccine in the U.S. In a study involving 38,000 people aged 60 and older, the shingles vaccine reduced the incidence of shingles by about half and the incidence of post-herpetic neuralgia by 2/3. Unfortunately, vaccine effectiveness drops within the first 5 years after vaccination, and protection beyond 5 years is uncertain. The vaccine is most effective in people under the age of 70. Because of this, the CDC recommends the shingle shots for adults aged 60 and older. The FDA has actually approved the shingle shots for adults aged 50 and older, but the CDC recommends waiting until age 60 since this is when the vaccine would be most effective. The shingle shot is given once and is recommended whether or not you've ever had the shingles outbreak. If you have a current outbreak, you should wait at least until the rash is cleared before getting the vaccine. While you can still get the shingles after having had the shingle shot, the vaccine does reduce the severity and duration of illness. As with all live attenuated vaccines, it is contraindicated, not recommended, if you are pregnant or immunosuppressed. Pregnancy isn't too common in women over age 50, so that doesn't tend to be too limiting. Causes of immunosuppression are listed on the slide. Anyone with a severe acute illness or a temperature of 101.3 or higher, that's 38.5 degrees Celsius to the rest of the world, should delay getting the vaccine until they are feeling better. Side effects of the vaccine are mild and can include a rash resembling chickenpox and soreness, swelling, itching, or redness at the injection site. Symptoms are uncommon but can include headache, fever, chills, upset stomach, or pain and tingling. People who receive the shingle shot do not infect others with chickenpox even if a rash develops. Shingles is a bit depressing, but if you're looking for something to cheer you up, may I suggest my novel, Didn't Get Frazzled. Recently described as funny yet serious, well-written, and authentic by an Amazon reviewer who wrote that she should know since she was once the wife of a medical student. My sincere condolences to her. Didn't Get Frazzled has been a #1 Amazon bestseller in this category several times so far, so thanks everybody for that. 4 fun facts about shingles. 1. Avoid picking at and scratching blisters. If left alone, the blisters will crust over and fall off naturally. Cool, moist compresses, lotions such as calamine, and cornstarch or baking soda may help. 2. The AICP states that everyone born in the U.S. prior to 1980 are considered immune to chickenpox, varicella. However, if you have a blood test that shows you're not immune to varicella, you should be given the varicella vaccine, not the shingles vaccine. 3. Post-herpetic neuralgia can last for months or even years. Anticonvulsants like gabapentin or Lyrica or antidepressants like amitriptyline may help. Topical treatment like lidoderm patches or capsaicin cream may help you manage pain and hopefully avoid the need for chronic narcotics. 4. The varicella or chickenpox vaccine was introduced in the U.S. in 1995. Besides protecting against chickenpox, the vaccine strains are thought to be both weaker and less likely to reactivate to cause shingles, so the younger generation should have both milder and fewer cases of shingles than adults do today. Yet, in the United Kingdom, the chickenpox vaccine is not part of the routine childhood schedule. Why is this? Well, adults who are exposed to children with chickenpox actually have a reduced risk of shingles. The controversy of starting a vaccination program that might disadvantage the middle-aged and elderly, but would greatly benefit the children, continues in the UK. In the US, we made that decision 22 years ago. I wonder sometimes what Charles Dickens would say about all this. Actually, I think I know. Thank you for watching Didn't Get Frazzled presents The Shingle Shot for Patients. For additional information, go to my website, davidzhirsch.wordpress.com, and click Videos. There you'll find all of my videos along with hyperlinks with more information on the issues discussed today. Please like the video and click subscribe so you'll be notified whenever I post another detailed video on common medical conditions. I wish you all good luck and good health.